Hello and welcome to my mentorship video. Before I begin, I would like to give a quick disclaimer. There are a few graphic images, so just be aware. I did a mentorship in 3 different areas. I did oral surgery, specifically periodontics, general surgery, and also did phlebotomy. Today I will be going over all 3. Alright, so first I have periodontics, which is oral surgery to be exact. For this mentorship, my mentor was Dr. Melton, who was a periodontist. This mentorship did take place in Dr. Melton's office, which means that he does own his own practice, which I thought was really cool. One of the reasons that I chose to do oral surgery as part of one of my mentorships was because I was really interested in surgery, and I still am, but I wanted to ease my way into it, and I thought that oral surgeries would be a good way to do so. Aside from surgery, I learned many things, like for example how they clean their instruments. So here you see a dental ultrasonic cleaner, which is a machine that uses ultrasound to agitate fluid, and it helps prepare the instruments so that they are essentially clean. However, they're not completely sterilized, and it prepares them for the next step. Essentially, the next step is to wrap up the dental tools after drying them and to put them into the autoclave, which uses steam under pressure to kill bacteria, viruses, and spores. Once they are done in the autoclave, then you can see that the instruments are sterilized and they are ready to be used on a patient. I was also able to see how they do their x-rays. So for example, here is a CT scan machine, and they would just place the patient under and in between that machine, and then that top part would just kind of spiral around the jaw, and then it would give a clear image. Here is what the finished product would look like, and these images are essentially used to see what course of action needs to be taken for the patient. And of course, I did see multiple oral surgeries. I would say that I saw at least 2 oral surgeries every single day that I would go. However, the oral surgeries were the same procedure, or at least the same 2 different kinds of surgery. And this is kind of what the room would look like. However, I would say that the room in Dr. Melton's office was a bit nicer. Something that I saw a lot that they did was bone grafts. So bone grafts were used to prepare for a dental implant, or even just to restabilize an existing tooth. A lot of surgeries that were done were used for implants. Here you can see where they would essentially make an incision in the gum, and then they would pack it with the bone graft. They would let the bone graft heal for a while, and then they would place a screw, and then they would attach the dental implant. However, this process takes months. This here is what the screw would look like under an x-ray. So you can see that that's an implant, and the screw is what holds the implant in place. And at the end of each patient's course of treatment, you would end up with a happy patient with a nice smile and better confidence. Overall, I would say that I had a really good experience. Dr. Melton was a really nice doctor, and he gave me a lot of good advice. And I also got along very well with all of the dental assistants. I got to see what they did, and I also got to see what the dental hygienist would do. So I was able to just float around the clinic and kind of see a little bit of everything. I don't like oral surgery specifically because I'm not very interested in the mouth, nor do I want to pursue oral surgery. However, I did learn that I do like patient interaction, and I do like surgery. I just wouldn't pursue it in oral surgery. Next up, I have general surgery, and my mentor's name was Whitney Lewis. She is the director of surgery. She's not a surgeon herself. So each time that I would go, I was assigned to a different person, so I was able to see different areas in surgery. I did my mentorship here in the Christus St. Vincent Hospital in Santa Fe, New Mexico. So each day that I would show up to my mentorship, I would show up in my Christus St. Vincent polo and some slacks. However, when I got there, I would change into scrubs, and I would use this ScrubX machine, which is an automated machine that gives you a new pair of scrubs or a clean pair of scrubs. All you do is put your size into it, and that's what you get from the dispenser. On the days that I would see surgeries, I would put on my PPE, so that consisted of gloves, a gown, a hairnet. I would actually have to wear 2 just because of the length of my hair, some shoe covers, a face mask, and a face shield. And that is what this looks like. This is required for you to enter the OR, especially when a surgery is going on. One of the types of surgeries that I saw was a robotic surgery, and they would use a Da Vinci machine. So how this worked is that there was a console. The surgeon would control the robot through the console. His hand movements will translate to the arms of the robot in real time, and he would just kind of be in a corner doing that while the robot arms were inside of the patient, and they would do whatever. I remember there was one patient who had an umbilical hernia, so he did receive surgery. This is more so what the operation room looked like. And here you can see that there's a mesh, so the surgeon would look for the weak lining of tissue, and wherever that was, he would place the mesh to essentially heal the hernia, and then he would just go ahead and sew up the patient, and then the patient would be sent to the post anesthesia care unit. So a lot of my mentorship, I did spend it in the post-anesthesia care unit, which is where they send patients after surgery. Here you can see what the patient perspective is. They're put into one of these bays, and they would assess the patients after surgery, make sure that they were awake, that they were conscious, that they felt okay. In most cases, they would wait to make sure that some patients would be able to urinate depending on the kind of surgery, and they would kind of just assess their mobilities. They were in here for about 20 to 30 minutes, and then they would be sent home with a family member. And then this here is what the nurse's station kind of looks like. These aren't actual pictures from Christus, but these are pictures I found online. So because a lot of my mentorship for general surgery I spent in the post-anesthesia care unit with the nurses, I was able to have a lot of patient interaction. I was able to speak a lot of the patients, and I would say that it was a really good experience. It taught me that I do like the patient care aspect of healthcare, and it kind of let me see what areas I'd be interested in. For example, I wouldn't want to do something like labs where I wouldn't ever interact with patients. Alright, so the biggest reason I chose to do a mentorship in this is because I have always been interested in surgery, and before this I wanted to become a surgeon. What I can say is that even after this, I still want to become a surgeon. I learned some things like that I wouldn't want to, for example, become a nurse, just because I wasn't too happy with the scope of things they could do. I felt that there was a lot of limitations on what a nurse does, and so I would just personally prefer to become a surgeon and to be able to do what they are able to do. So yeah, the only thing though that I wouldn't do from this mentorship, aside from nursing, but like for surgery, is that I wouldn't want to do general surgery, just because I felt like a lot of the surgeries are a little too repetitive. That, and I would like to go into something that is a little bit more detailed and is more meticulous. Alright, so lastly, I did include phlebotomy into my mentorship, and phlebotomy is the puncture of a vein in order to withdraw blood. And the reason I included this was because I did a lot of hours for it that I used towards my mentorship, and I did this through the Santa Fe Community College. For phlebotomy, I actually did clinicals, and I did 100 clinical hours because that's what is required of the program. But before I did those clinicals, I had to learn how to insert the needle and essentially how to withdraw blood, which I will be showing in the next clips. Alright, so first we had to learn how to anchor our veins, how to insert the needle at an angle, and then we would practice changing tubes. So here you can see that I have inserted the tube, and then there is fake blood coming into the tube. This is just water with food coloring, but this is how we would do it, just to learn how to insert the needle. And we would do this before we were drawing on each other, just to make sure that we had an idea of what it is that we were doing. Then this is a picture of me where I am holding the pad of fake skin that we used to first learn how to insert our needles, and in the other hand I am holding a tube with actual blood that I drew from one of my classmates. After learning how to withdraw blood, I transitioned into my clinical rotation, and I did these at Tricor. My specific site was Tricor in this Presbyterian building that is across the street from the Christus St. Vincent Hospital. Here is a quick video of what the bays look like where we would sit down our patients. Here's the phlebotomy chair, and then I have my tourniquet on that side, and then this is where we have all of our materials that we use to draw blood. Here we have our gloves and co-band, and then we have a curtain. Here is a picture again of what the room looked like, and there were 4 rooms that looked just like this. This picture here shows what we use when we work with patients. These are all of the materials that we use in phlebotomy. Alright, so here you can see these are some of the urine specimen cups that we would hand to our patients whenever they needed to collect a sample of urine for us. Some patients also have to bring in stool samples. However, they take these cups and they do that at home. So here I have some more tubes, and these are they all have different color tops because they have different additives, and you use different kinds of tubes for different tests. Keep a lot of these red SST tubes and the lavender tubes just because they are what is used most often, and so we actually go through a lot of these. Here are some cotton balls that we place on our patients after we draw their blood, and then these are hubs with safeties that we would then attach to these needles. And then these are alcohol pads that we use to clean the area that we are going to be using to draw blood from. As you can see, this has everything that we need. The only thing that isn't pictured here are the gloves and the co-band and the tourniquet. But that's because we place those closer to the chair and not as up high, just so that they are a lot more accessible to us while we are drawing patients. This here again is the blood that I drew from one of my classmates. I can't show blood from the patients just because of HIPAA. And then here I have Miss Bakovich, and the reason I included her is because, like I said, I can't include pictures of me with patients. But this is just a picture of me after I drew Miss Bakovich's blood. Alright, so the reason that I did this as part of my mentorship was because I really wanted to gain clinical experience. Like I said, I'm really happy that with my other mentorships I got to have a lot of patient interaction, but I wasn't able to do anything besides see. So I really like that with this one I was able to actually, be the one drawing blood or doing the action, I guess. And it's not my career goal, but it is something that I want to do while I am in college or even just to gain clinical experience. And now we are at the end of my video. I would like to thank my mentors just for allowing me to shadow all of them, and I would say that I had really good experiences with all of them. And as of right now, I can say that I still want to pursue surgery and hopefully one day become a surgeon. However, I think that I learned many valuable things from each mentorship about myself and about the career too.